Back. Well, if you or a loved one make frequent hospital visits due to several chronic health conditions, then listen up. One local medical group can help you make the experience much more comfortable. Landmark Health is a mobile provider group, and what that means is they make house calls in an effort to help you avoid multiple trips to the ER. Joining me now is Landmark's community health advocate, Ashley Menke. Now, Ashley, thank you so much for joining us this morning.
Hi, thank you. Thank you for having me.
Of course, yeah. So can you speak to some detail about, how making house calls for those people who are truly sick can benefit both the patient and their families?
Absolutely. One of the unique aspects of Landmark is that we do these old-fashioned house calls.
Right.
We're bringing house calls back. And so we can go into the home, we can take the time to really get to understand the complex medical needs of that patient. And with the input, if they want it, from their family members, can add a lot to really understanding how we can best help these members.
Sure. And so are these nurses or technicians, or these people become kind of like your family, right?
Yes,
and sorry,
yeah.
double-sided question there.
Absolutely. They're advanced practice providers and physicians, so that they can come in and they can assess and diagnose and treat, and you can get a really intensive medical care right in the comfort of your home.
Sure. And so it sounds like a true friendship. You're building a friendship with these people, right?
Absolutely. Our providers care very deeply about their patients because they're spending so much time with them. They're in that intimate environment of the home, and they're really getting to understand what they need. And it's not just about medical goals. They're looking at what are your life goals.
Right.
Do you want to be well enough to go visit your grandson in Houston? I'm going to get you there.
Right. Here's what we need to do
Yes.
for you to be able to achieve that.
Right. So that's just as important as having your measurements right for managing your diabetes. It's also being able to meet those lifetime goals too.
So it's like you get a lifetime coach and a nurse.
Yeah, absolutely.
On your side. That is really great. Okay. Well, we have a video of an elderly woman named Yvonne who is one of your patients. It's a testimonial from both Yvonne and her daughter-in-law talking about how Landmark Health has really made a difference in their lives. So take a look.
Yvonne is my mother-in-law. Now that she's 96, it's just harder for her to go out of the house. It's harder to go to doctor's appointment. It causes us a lot of anxiety. It's always a big challenge. Having Landmark a phone call away has given us tremendous peace of mind. Our whole family feels lucky because Landmark solves so many problems. My hopes for Yvonne that she can continue to have quality of life as much as possible. And we can keep Yvonne in the house like she wants to be and not ever think of moving her anywhere else. It makes a huge difference in our lives.
I am very happy to stay in my house with all my family because they are my family, my love, and you are very good for me. A very good doctor. Thank you.
Oh, that's so sweet.
It's very sweet.
So, I'm sorry, go ahead.
Yeah, to see a testimonial like that, it really brings to home what our goals are with Landmark. Yeah.
And Yvonne isn't the only one, right? I mean, there's so many elderly people who can benefit from Landmark
Yvonne is not alone. There are lots of people that we're already helping, and we're every day trying to reach more of those people to help them, people that have these chronic conditions and really complex medical needs where the traditional facilities and things that are in healthcare right now are just not enough. They need those too.
Sure.
And we work with them, but the addition of the Landmark support is really what they need.
So is that what separates Landmark from other primary care providers, or?
Yeah, so we already have really great provider groups in the community, and we're so grateful to them. What our goal is not to replace them, it's to complement what they're doing. Our members' relationships with their providers is extremely important, and we encourage that relationship. We encourage them to go to the doctor more and follow their plans of care. We help them follow their doctor's plans of care.
Right, so you're a coach. I love that. So what type of care do you bring into the home?
We can pretty much do anything that can be done in an urgent care clinic medically. So we can provide IV fluids. We can give medication, we can insert catheters, we can do a lot of services that might be done in an urgent care clinic. And then we also do the follow-up, the maintenance and making sure that they are continuing that care plan that the doctor wants them to have.
Wonderful. Okay, and then you're growing locally too, which is great. So you're actually looking to hire.
Yes.
What positions are you looking to fill?
So it's exciting. We are growing exponentially in the in the Louisiana and the Gulf Coast, Mississippi area, new to this market, but we are looking for advanced practice providers, physicians, to go out to these members' homes and treat them at home. We also have a office in Metairie where we have a clinical staff, nurses and other clinical care coordinators, and so we're always looking for great people to help us at the home base too.
Sure. Okay. So other than Yvonne's story, I mean, is there someone else that you might be able to speak to, or just a scenario without obviously giving away people's names
Right,
and identities
right.
that, you know, where you felt like you've really been able to help
Okay,
someone?
so
or
I
you've
did
seen?
have a personal experience. It was a new member, and we had just met with her and explained, you know, how we can provide her and the rules for calling us and letting us come and assist her. And she still had my phone number from my initial outreach to her, and she called me and she said, you know, Ashley, I'm in the parking lot of the emergency room, and I remembered
Oh, wow.
that I had Landmark,
Right.
and that I can call you and you will come help me.
That's
and
wonderful.
So,
I love
you
that.
know,
Well,
so,
good.
and,
I'm
and
glad
we
that-
were able to care for her. It was not
Right.
an emergency
That's
room
wonderful. So
necessity.
Landmark obviously helps. If you want more information, you can head to their website. That's on your screen. We'll be back after the break. Thank you.